Okay, doctorarjaybe, and I wanted to talk a little bit about osteoporosis. These days, we can do a type of bone scan to be able to determine the health of the bones. Usually, once you get to a certain age, they start talking to you about getting this done. For women, after they get past menopause, it's usually a good idea to kind of check this to see what the health of the bones is. And then they basically give you a score, and they can tell you, how good the bones are, how bad the bones are. There's a couple of ratings on the bone scan, the osteoporosis scan. One is called osteopenia, and the other one is called osteoporosis. I wanted to address what's the difference between these two. Osteopenia is a point where there's not enough calcium in the bone. So there's a decrease in calcium in the bone. The bone is made up of a structure, and on top of that structure, there are calcium salts, which give the bone strength. So having less calcium means that the bone is not as strong as it should be when it is fully loaded up with these calcium salts. The structure of the bone is intact, everything else is good, but there's just less calcium salts in the bone. And so there is a risk of fracture, but not that great. Now, the next stage is what we call osteoporosis. Osteoporosis, the last part of it is porosis. Pore is a hole. So you're talking about osteo, which is bone, pore, which is hole. So there's actually holes in the bone. Now they describe this as the situation similar to the sponge that you use, to wash your dishes, where it's full of different holes. And that's the way that the bone looks. It looks like it's full of holes. And the reason for this is that the bone structure, which is made of protein, has been damaged. And so besides the fact that it has less calcium than a normal bone, there's also a damage to the protein structure of the bone. And this is a more advanced state than osteopenia. Once you have osteoporosis, there's a much greater risk for fracture. And in some cases, it can be a fracture with things that normally would not cause a fracture. Years ago, I had a patient who broke her arm, and when I asked her what caused the break in her arm, she says, "Well, I reached for my purse and my arm broke." So it was just a mild trauma that caused the fracture of the bone. It was just the weight of the purse, or something about the movement of trying to lift the purse that caused the bone to break because it was so fragile. There have been situations where somebody is doing something in some sort of a sport, and they do a quick movement and the bone breaks. Again, these are what we call a pathological fracture. It's not a normal fracture where there's been sufficient trauma to break the bone, but it's a pathological fracture because it's a situation where the bone should not normally break. And usually if it's a suspicious fracture, they'll take a look at the bone and be able to determine, oh, but there's osteoporosis here, so that's why the bone broke. So the bone becoming brittle with osteoporosis, easy to fracture. These are the situations where we're especially concerned about falls. In the normal individual, if you lost your balance and you fell, a short distance, normally it would just hurt, but it shouldn't cause a broken bone. But for somebody who's older, who has osteoporosis, if they fall on their butts, there's a good chance they might break their hip. And because of osteoporosis, it's going to be harder to treat that bone because the bone is not strong. And so there could be considerable disability with the breaking of the hip bone in that case. Now, somebody is, let's say in a car crash and they break their hip, and they're a young person, doesn't have osteoporosis, their chances of recovery are very, very good. More than likely, they have surgery, they fix their hip bone, and they're back to doing all their activities within just a few days. But somebody who is older, who has osteoporosis, and they break their hip, there can be a long period of recovery. And in those cases, the concern is that they may never be able to get back on their feet again. And usually this kind of disability increases the risk of mortality to that person. So that's one of the reasons why we treat osteoporosis aggressively, because we know that in those cases, if there is a fracture, that it's going to cause considerable disability and could even cause morbidity and mortality for that person. So this is why we treat osteoporosis, like I mentioned, aggressively.